Afternoon, where else ever you are in the world. This is the SICOT Fellowship Committee, or rather a part of it. And we are here to simplify your path uh, to getting an international SICOT Fellowship. Is there some disturbance from someone?
We should unmute ourselves, all of us.
Yeah, just mute yourselves. Yeah. So where I was that we are going to simplify your path to getting a SICOT Fellowship. We have the chair of the fellowship committee, Professor Khalid Emara from Egypt. We have the past chair, Dr. Bassel El Osta. He's from Lebanon. And we have a very active and vibrant senior committee with us who has been responsible not only for choosing the fellowship centers, but also allotting the fellowships based upon a very, very fair system of assessment. So we are at WIROC 2024, which is the annual conference of the Bombay Orthopedic Society. And this is a part of the pre-conference webinars where we try and connect with our audience, with our young audiences. And today is one such attempt. So without any further ado, I would want Dr. Khalid to take over as chair of this session and also to begin the session. Over to you, Professor Khalid. Please unmute.
Yeah. Thank you, everyone, for inviting me, and I'm really honored and glad to share with you this webinar. And I think it will be helpful for many of you, and hopefully you will get the chance to improve your career and gain not only the success, but also the success and the wisdom of being an orthopedic surgeon and helping your patient and yourself. My talk will be an introduction. Can you see my slides?
Yes, yes. Please go ahead.
Okay. So, as you see, we have a great panel, including Dr. Patricia Fuchs and Dr. Bassel Osta and many of our fellowship committee, and they will give you a great insight, not only on how to apply for the SICOT fellowship, but also on how to create a successful career for yourself. So, as Dr. Kinney said, my name is Khalid Imara. I'm a professor of orthopedic surgery in Ain Shams University Hospitals in Cairo, in Egypt. And I'll talk to you about how to be really a successful doctor in the 21st century. Remember, orthopedic surgery is not only mechanics. It's not only plates and screws and arthroplasty. It's mechanics and biology, because sometimes some doctors think about the proper fixation, proper alignment, but they forget about the biology, either the biology of the patient or the psychology of the patient or the blood supply of the limb. So you need to think about your patient as a whole. And it's not only a three-dimensional way of thinking. We have to think four-dimensional. What's the fourth dimension? It's time. So when we treat, for example, a child, we correct this crooked bone or this deformity, but we think about how time will affect this crooked bone, the growth, the gradual correction during lengthening or external fixation, the wear and tear in an arthroplasty that you are putting. So when we think about any patient, we think four-dimensional. So in my country, we call a doctor, we call him or her Hakim. Hakim means the wise man. And actually, this is not only the culture in the Middle East and Africa, but also I think it is the culture also in the Far East and in South America. They also look at the doctor as the wise man, this someone that deal with the private issues of people. So your job is not only to treat patients. Any successful doctor need to do three tasks: treat patients, do research, teach people. If you are treating patients, that's only 1/3 of your job. You have to be a good doctor, successful in teaching your patients, but also you have to be good teacher, good communicator, able to communicate either with the patient to teach them what they should do post-operative, dealing with the nurses, dealing with your young and junior residents, dealing with students in your class. So being a teacher is very important skill for any successful doctor. Researcher, because we want in SICOT, we want all of you, all of orthopedic surgeons, not only to be good users for science, but also good producers for science. So we don't want you just to read the most recent paper. No, we want you to read this most recent paper and reflect on it and tell the world about your experience with using this technique in your population. So you learn from others and others learn from you. And regarding good treatment, it doesn't only include surgery. Good treatment means proper diagnosis, which is intellectual knowledge, and proper treatment, which is partially hand skills from surgery, but also part of it is the planning for surgery and how should you follow your patients post-operatively, and then application of the plan. So when you are treating people, it's not only hand skills, because some of my junior residents only think about skills, hand skills. Actually, hand skills are very important for us, but this is not the only skill that you need to learn. So you need to improve your knowledge, your skills, and your attitude. So orthopedics is not only about knowledge. It's not only about books, but also it is not only about skills of how to make a cast or how to do a total hip or how to fix a plate or how to put an intramedullary nail. And I would like to tell you maybe it is something good or bad, I don't know. But when you go to medical school, now you are not, medicine is not only a job, it's a way of life. You will not be able to retire, even if you decide to retire, because the word that Dr. X, Dr. Z, this word will be part of your pride, part of your self. You will not be able to give it up easily. So medicine and working in medicine is a way of life. And when you guys went to medicine, you didn't go to collect money. If you went to medicine to be a billionaire or to be like Elon Musk or Steve Jobs, let me tell you, you went to the wrong school. You will live okay, but you will not be super rich and you will not be poor. So you went to medical school to gain respect, to gain self-respect, people respect, to be happy about yourself. And for us, we are doctors, so we are dealing with science. What is science? It's an evidence-based way of thinking. It's a critical thinking. And how to do that? You have to find the right question in everything. You have to put the aim of the work. You have to know where are we going? What is the aim of treating this patient or doing this research? Then you search for the best available answer. And then after that, you try to go further step. We are doing research. You are not searching, you are researching. So the best available answer arrived to level 5. So you aim to go further step to level 6. How to do that? By putting the proper methodology to answer your question that you're looking for. And then after applying your methodology, then you analyze the outcome and the results. That's how any scientist would think, either in treating people or in doing research. So here in the 21st century, there are rules of the game. You have to understand the rules of the game. What are the rules of the game for someone who would be considered a successful doctor? First, you have to internationally publish scientific papers. That's number one. Number two, publication without citation is nothing. You have to publish useful information so other people would make use of it and use it as a reference and citation. Number three, bringing fun to your institute will raise your level and respect in your institute. Number four, recommendation letters and word of mouth. They say, oh, Dr. Basil is a great one. Dr. Swapnil is good. Dr. Patricia is excellent. Stuff like that. How to do that? Networking. Networking is very important. If you are a great doctor and you do a lot of science, but nobody knows about you and nobody knows what you are doing, no, you are nothing. Nobody will hear about you. So you are still someone very local in your small town or in your office, and that's it. But if you really want to be recognized and grow in the field, you have to create your network. And we in SICOT help you with that. How? You need to do international fellowships, travel outside your country and visit different centers. You can do national fellowships. You get recommendation letters from people who you contact them and they know you, they meet you in a conference or they meet you in the fellowship and they get acquainted. Oh, this guy is great. This guy is excellent. I would support him. Traveling for short observerships, traveling for long observerships or fellowships. As I was saying, attending conferences, membership in societies. And when you look for a society to be a membership, you have to look for three kinds of society. Your national society, the Indian society, the Saudi society, the American Society of Orthopedics, stuff like that. An international society like SICOT, and a specialized or subspecialized like the Sports Medicine Society, the Limb Reconstruction Society, the Pediatric Orthopedic Society, stuff like that. And today, in the 21st century, you have to update yourself and upgrade yourself, not only in surgery and in knowledge, but also you have to add the AI and the technology. For a doctor today in 2025, if you are not able to use AI in your daily practice, you will be expired at some point in the very near future. Trust me. So you have to update yourself. We want you guys to be public figures. We want communication skills. We want you to protect our profession, to communicate with people, with the society, with the community. We want you rich. We don't want the poor doctor. We want you rich doctors, happy doctors. So the stages of lives, we always start by needing others to take care of our needs. And then we grow and support ourselves, like during your teenage and young doctors. Then you support your family, so that's a wider circle. Then you are able to help your community. Then the larger is creating a larger and higher purpose to support. So you need to look for a larger goals and you not only think about getting some money and supporting yourself or supporting your very close and very near family. So the best thing is to support a greater cause, like treating people, educating people, helping people around the world, helping humanity. That's where we, SICOT, help you to be a trainee, to make friends, to communicate with colleagues from all over the world, to be a trainer later on, and to improve. So my last word, we doctors need to be more proactive, to be more helpful to our community, not just treating physician, but doctor or wise man or hakim need to be larger than just prescribing drugs or doing a few steps in a surgery. We need you more than that. We need you more skillful in communication with the community around you. Thank you, and I pass the talk to my colleagues. Thank you very much.
Thank you very much, Dr. Khalid. We'll now move on to the next talk. which is selection and application process for SICOT fellowships by Professor Bassel El-Osta. Over to you, Bassel.
Thank you so much, Pampil. Hi, everyone. Khalid, a great talk. I'm honored to be here in this forum. And I'm going to take you through a process that has been developed by all of us, mainly to say how we select candidates and how we are fair in our selections. So people who think that it's only about connection, no, it's not. In our process, we are very fair and we are very anonymous, and we will see how it goes. So, how we select candidates? Sorry. Okay. Now, so as you see, we select candidates by name, by country, by connection, by supervisor, by bribing. So who pays me more money, I will let him in the fellowship. Okay. If you are from a rich country, I will let you in for sure. And if someone give me a ring, then definitely you are in. And if I know your supervisor, like Swampil, then Swampil, he will give me a call and you are in. No, it's not the case. Okay, never, 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 ever. So we select candidates. It's a very fair system. It's very point-based. Okay, so we are going to go through the point-based system now, and you have to register that because this is how we select candidates. So now we are a young, old organization for young people. Okay, so for us, age is very important. Younger you are, more points you get. So it is well defined that younger people, you are more points you will get. So if you are between age of 30 to 35, you get 10 points. 35 to 49 points. More than 40, you are at 8 points. Criteria 2, it's a logbook, and it is a must. Now, we have a problem here that most of people or most of young people, they don't know what is logbook. Now, logbook, it's something very important, and it has been developed a long time ago in the United Kingdom. And every single residence, since I was there and even before me, we used to have a platform where we put all the surgeries that we assist, we do, or we just observe in that logbook. And this will give us a good confidence in the candidate. Why? Because I don't believe that somebody who just finished training and post-surgery and he wants to do fellowship, he did something like 5,000 hip surgery. Okay, so the logbook will give us the truth and will give us a good looking to young people how they are performing. Now, academic achievement criteria, we like people to be, while they are doing fellowship, to do research, to do studies, etc., to do audits. So they need to have a good academic background. So if you have more than 10 publications, you'll get 10 points as first author. If you have 5 to 10 publications, you get 9 points. Anything less than 5 publications, you will get 8 points. Criteria 4, it's other achievements like rewards, prizes. If you have between more than 5, you get 10 points. 2 to 5 is 9 points, and less than 2 achievement is 8 points. Not necessarily those prizes to be in medicine. It can be in volleyball, it can be sports, it can be, I don't know, in some math competitions. Regardless, the most important is for you to achieve, and this is what the point. Years of experience criteria, if you have, so here you can see that less you have experience, we are more than happy to offer you more points. We like to encourage young surgeons. We like to encourage young people to go forward. So if you have less than 5 years experience, postgraduate, you are on 10 points. And if you have between 5 to 10 years, it's 9 points. And more than 10 years is 8 points. Letter of introduction, everyone will have letter of introduction, okay? And here we are, if it's well written, 10 points, average written, 5 points, badly written, 0 points. What does that mean? Badly written, I received one day a letter of introduction, says the following. I've been applying for the fellowship for the last 3 years. Now, it is a must for you to give me a fellowship. I'm so sorry. This application didn't go through even to the next round. Okay, well written is not 3 letters, 3 pages of introduction. Well written means straight to the point and why you want to do fellowship. English professionals is very important. We do have a lot of people, unfortunately, they don't speak well English and they are going to English trainee. And there is a problem here because this will be the main language. So we like to have evidence, and it is more powerful if you have an international evidence rather than local or no evidence at all. Letter of reference, everyone will have 2 or more excellent letters. So most people, they will get 10 points. Barely I've seen somebody written poor letter. Field of interest criteria. This is very important because people that, for example, on logbook, they are doing fellowship. This doesn't match. Okay, so you need to apply for the fellowship that you are interested in, and it will give you the full marks. Because if you are just because, for example, there is a fellowship in Switzerland and you like to go and visit Switzerland, then but the Switzerland has knee surgery and you are mainly hip surgeon, then it will not go. So, and it's written clearly here, relevant with fellowship 10 points, only for experience 5 points, and it's for holiday points. And trust me, people, they might ask, how do we know? We know everything. Final criteria is if you are a SICOT member, and this is crucial. Guys, this is crucial. SICOT member and attendance of world congresses. If you are 5 years member and 3 OWC, you'll get 10 points. 2 to 5 years and 2 OWC, it's 9 points, and less than 2 years and less than 2 OWC, it's 8 points. Overall, the selection criteria is based on 100 points that each candidate will be given the scoring by 2 different members of the committee. Afterwards, the shortlisted candidates will be sent to the center where they refine the selection. So this is the second round, and the chosen candidate will be notified accordingly. Now, the time frame, the usual selection happened within a month of closing date. So we are very quick and efficient, but unfortunately, sometimes it gets delayed due to unforeseen circumstances within the committee. Some people, they are on holidays and they've been given the task, or, you know, they got ill, or we are all humans. And Katya and the head office usually pushes everyone to finish their jobs on time. However, if it is nearby the Congress, World Congress, then there will be a severe delay in the answers. And after that, thank you very much. If you have any questions, I'm pleased to answer all of them. Thank you so much, everyone.
Thank you, Dr. Bassel. As you can see, this is a foolproof and probably the most transparent way of choosing a fellow. So if you have the necessary criteria, which includes a lot of academics and participation in SICOT, then you stand a very good chance in addition to your research commitments and your research work. Having said that, we'll go on to the next speaker, which is Dr. Toulouse, and he'll be speaking on the overview of SICOT fellowships and their eligibility criteria. Dr. Toulouse is from Nigeria. Over to you, Dr. Toulouse.
Thank you. Please, can you see my screen, please?
Yes, yes, Dr. Toulouse.
You need to put full screen. Yeah.
Right. It's full screen now, right? Okay, great. So I'll continue this talk by giving us an overview of SICOT fellowships and then subsequently the eligibility criteria. So most of the information I'll be giving us in this brief talk are on the SICOT website, which we can check out. Now, the options of fellowships we could categorize them broadly into 3. So we have single center fellowships, which are in 16 different centers. Then we have 2 traveling fellowships, and then the SICOT Meet SICOT fellowship, which are in 19 centers in different parts of the world. Now, these fellowships have various lengths of stay ranging from 1 to 12 months. And there are various financial support available between SICOT and the host center. Usually this ranges between 1,000 to 2,500 euros. And this fund is meant to support the fellow to cover travel and accommodation costs. Some centers offer food and accommodation at no cost to the fellow. So, but all of this will be dependent on the center, and all of that all of those informations are really available on the SICOT website. So the SICOT single center fellowships, these are the list of the various institutions, and we can see them in various duration for the fellowships. From Egypt, we have 6 to 12 weeks fellowship at the Ain Shams University, which is where the current chairman of the SICOT Fellowships Committee, where he practices in Egypt. And then we have various institutions as listed there. For time constraint, I won't go through each of them one by one, but as you can see from the slide, that they are in various countries across the world. Then we have the traveling fellowships. We have the Asia Pacific Spine Surgery / SICOT Traveling Fellowship. And then we have the SICOT Traveling Fellowship. The Asia Pacific Spine Society Fellowship is for surgeons who are interested in spine from outside the Asia Pacific region of the world. They are the ones who are eligible to apply for this fellowship, while the SICOT Traveling Fellowship is open to all parties. I mean, it's open to all SICOT members, regardless of which part of the globe where they practice or reside. Now, the SICOT Meet SICOT Fellowship, we have them, the duration ranges from 4 to 12 weeks, and we have different centers in different countries across the world. I just listed the countries where we have SICOT Meet SICOT Fellowship centers. Now, when we click on those countries on the website, we'll see the various institutions and then the criteria for getting this into this fellowships and what they offer, particularly the specialty they offer, and then whether the options open to the fellow, to what extent the fellow can scrub in or participate actively. All of those information are there on the website with the issues what I've listed here, the various centers, and then the subspecialty of orthopedics that are available. For instance, they offer general orthopedics and virtually all the various specialties of orthopedics, from spine to arthroplasty to complex trauma, sports. So those are the institutions with the subspecialty of orthopedics that they offer. Some institutions are specific, like the AO institution is just specific for sports injury. The Asia Pacific Spine Society Fellowship is strictly just for spine surgery alone. So those are the things to note. So some institutions have just specific centers, I mean, specific specialties of orthopedics that they cover. Like my institution, which is also a SICOT Fellowship Center, offers fellowships in arthroplasty, oncology, and pediatric orthopedics. So it's important to note all of that. The SICOT Meet SICOT Fellowship in particular covers all the various specialties of orthopedics. It offers training in all the various subspecialties of orthopedics. Now, what are the benefits of a fellowship, in particular in this instance, SICOT Fellowship? So they give an avenue for learning to broaden our knowledge, broaden the knowledge of the fellow in the specific area of orthopedics of interest, and also it's an avenue for enhancing skills. More importantly, also is cultural enrichment. Usually fellows go from one part of the world to another country that they are not used to, and they meet people of different cultures. So beyond learning orthopedics, beyond acquiring and broadening knowledge in orthopedics and increasing in skills, also cultural enrichment. Now we know the world is a global village. So we get to meet people from other cultural backgrounds different from what the fellow may have been exposed to from birth and growing up. Then more also importantly is networking. We get to meet other special, we get to meet colleagues, senior colleagues who have more experience. And we know networking, the world is a global village. We need networking to advance our practice. And that was elucidated in the earlier presentation by Professor Imara. So networking is key, and the SICOT Fellowship offers an opportunity to network, meet other colleagues, both contemporaries and senior colleagues, and learn and also climb on their shoulders to reach higher. Then also is an avenue to also learn how to teach others. Because of course, as one advances in the practice, one also gets gradually to also become a teacher, to also teach others. We learn so that we can also pass the touch and pass the knowledge even to others who are coming after us. So what are the questions an intending fellow should seek to get answers to? This includes what the subspecialty of orthopedics that the institution offers. So if you intend to go to a specific institution, you want to be interested in what subspecialty of orthopedics they offer training in, and then you want to know, okay, to what extent can you participate in their clinical program? In the operating room, can you scrub in or not? Some institutions allow a visiting fellow to scrub in, some are just strictly observership. So you want to know to what extent. Then of course, the local cost too, the intending fellow should also, when checking on the website for the center of interest for fellowship, you also want to know the cost. Like I said earlier in the earlier slide, what SICOT offers usually ranges between 1,000 to 2,500 euros. So you want to know how much more of your own personal expense, personal money that you may need to spend in covering the cost of the fellowship. Then of course, the cost of accommodation, you want to know, or if the center offers free accommodation, and then the other benefits. Some institutions give meal tickets for the fellow throughout the duration of the fellowship. So you want to be interested in all of that. Then also importantly, the opening and closing dates. So the fellowships are not open all year round. So on the SICOT website, which I shared earlier in the previous slide, when we go to SICOT under the education subsection, you will see fellowships option there, which you can click on. And then, so we need to check usually, from time to time to know the opening and closing dates for application for fellowships. Usually, most fellowships open in the first quarter of the year. So you want to apply when the fellowship is open, and make sure you submit your application before the closing date. Then also the application processing time that had been mentioned earlier by Dr. Basel Oster is mentioned the processing time. Usually we try to keep that as short as possible. The travel cost reimbursement procedure, the reimbursement is done following the fellowship. So yes, the fellowship may cover for accommodation and travel costs, but usually the reimbursement is after the fellowship, when the fellow would have submitted his fellowship report. But that's important. SICOT places premium on a report from the fellow, what the experience has been, both the positive and the negatives. So it's after the fellow has submitted his report of the experience during the fellowship, then there's a form, from the SICOT headquarters form, a reimbursement form will be sent to the fellow, where we'll complete the expense he has incurred, and then also attach appropriate receipt for flights, receipt for local travel, and also feeding as may be appropriate, and then the reimbursement will be done to the account of the fellow. But that's after the fellowship, not before. What are the eligibility criteria for SICOT fellowship? One, the person must be a SICOT member. Yes, there are some organizations, international organizations, that are not members of the association, but that does not apply to SICOT. The intended fellow must be a SICOT member, a registered SICOT member. and this member must be in good standing with membership dues paid for at least the 2 previous years. This is crucial, which is why I put it in uppercase. Any applicant that does not meet this criteria will not be eligible. Also, any SICOT member who has received a SICOT fellowship in that year or the previous year is not eligible to apply. So the import of that is that one can be a fellow, one can go through a SICOT fellowship more than once during his career. It can be more than once, but at the minimum, there must be at least a 2-year gap so as to give opportunity for others to also enjoy the SICOT fellowship. But so it's not a once and for all. It's not like, oh, once you've enjoyed SICOT fellowship once, you can't apply again. Yes, one can apply again to either to the same institution or to a different institution, but at least 2 years must have elapsed before another application is submitted for a SICOT fellowship. And of course, the intending fellow must demonstrate interest in the subspecialty, and that will be shown in the application. The intended fellow submits. Age is also important. For most of the fellowship programs, the fellow is expected to be less than 45 years, except for the SICOT fellowship, where there is a senior category. In the senior category of SICOT fellowship, age is not a criteria. The intended fellow may be above 45 years, but for all the other categories of SICOT fellowships, they have an age limiting criteria of the individual being below 45 years. Like Professor Oster mentioned earlier, premium is placed, the younger the intended fellow, the higher the prospect of the fellow getting a SICOT fellowship. Nationality also plays is also important for some fellowships, like the Asia Pacific Spine Society Fellowship. The individual must be applying from outside the Asia Pacific region. So it's not open to those who are within the Asia Pacific region. But for most fellowships, nationality is not a criteria. Thanks for listening. Thank you.
Thank you so much, Dr. Toulouse, for elucidating all the points and also highlighting the kind of fellowships we have. So as the audience can see, there are so many fellowships which are available. Sometimes we don't have adequate applicants. So I will urge all the listeners who are listening to this or seeing this webinar, and those who will see it in the future, is that please apply, because for all you know, you might be the next visiting SICOT fellow. Having said that, I will go to the next talk, which is by Professor Patricia Fuse from Brazil. And this is what to expect from a fellowship, change in perspective. Over to you, Dr. Patricia. Dr. Toulouse, can you stop sharing your screen? Yes.
Yeah, now I can share. Is that okay with the screen?
Yes.
Good. So first, thank you very much for the invitation to participate. Actually, I was a SICOT fellow long time ago, so I only thank SICOT for helping me in my career. So I work in this beautiful hospital in São Paulo, which is a charity hospital, and I'm the chair of the neuromuscular clinic. So what do you expect from a fellowship? And I think this webinar is especially for the young guys and the possible changes in perspective. So I'm not going to repeat it all. So in the SICOT webinar website, there are many SICOT fellows possibilities. So it's just being curious to see what you want to do and where you want to go. And if you meet all the criteria that it's important to get a SICOT fellowship. But there are many fellowships in the world, so it's not only SICOT, but you have to be curious. So what's the real meaning of a fellowship? It's just to go to a place to get a higher education or to improve your education. And why people, especially young guys, go to fellowships? Because they choose to learn more and to be researchers and to learn. And it's the fellowships usually is focused on professional, academic, or personal development. So it's your choice, you as a young guy, to choose. And as it said before, fellowships could be funded, can be long or short-term opportunities, and you have to choose. So what you need to know before applying, and I think that's the question, what do you want to do, where do you want to go, how to get the fellowship, and how to get the sponsorship for it. And after the fellowship, what you need to do is to share your experience, to share what you learn, to teach. And the last question is, does the fellowship change your life, your professional project? So where to start? So depend on the place you work, if it's academic position or it's in a private situation. And depend on you, what you want to do, because you need to be open to learn. And I think to the young guys, and I think this is a key factor, to be curious, to be disciplined, to be devoted to study, even giving up family and personal time. And then you have to find your way to make a perspective of your whole life as a professional orthopedist. So I think to be curious, to find your way, and to be devoted. Not only to be an orthopedic surgeon, you need to be a good doctor first, and then a good orthopedic surgeon. And what you want to do depend what you want to do. So you need to search for knowledge to improve your expertise, and could be in both ways, in basic research and in the applied research. And we all treat patients when we need to improve quality of life of our patients in either areas. So there is this posterior quadrant that exposes where you can do your knowledge. So you can do just pure basic research, and you can do clinical or applied research. So I think for the young people, they need to define themselves where and what they want to do, first of all. And after the fellowship, I think it's very, very important to share, to help your young assistants or your residents or your fellows to progress in their academic careers. I have my junior assistant, after many, many fellowships, he got his master's degree and then his PhD degree. So he is improving in his expertise and in his academic career, which is very important because we belong to a medical school here. So among all the fellows that cross my way here in Santa Casa, one is AO from spine, the other guy is AO for trauma, all residents that pass here and that get fellowships, helping with many people that I know around the world and achieve brilliant careers today. So it's very good, and I'm very proud of my ex-residents and ex-fellows. And as I said, I was SICOT fellow, and I found out the advertise of the SICOT fellowship in JBGS like 30-something years ago. And then I sent a letter because there was no internet at that time. And then I went to the DuPont as a SICOT fellow with Professor Dean McHugh and Professor Jay Kumar. And then I got many other fellows around during my career. But for sure, being this first fellow as a SICOT fellow at the DuPont Institute completely changed my life because I was there. I came at that time from Brazil, so completely different place, completely different style of work, and I have excellent professors over there and of course change my career, because I stay in academic position until I get my full professorship position. So I think the fellowship, and thanks to SICOT, changed completely my career. And it happens with all my young guys. This is the last one. He made the master, the PhD. Now he's a professor at the medical school here. So I found out this very interesting concept that I think for the young guys, it's very, very, it's a very good time to reflect about life, because they are young and they are choosing their paths. And it calls Ikigai, which is a philosophy of life, a Japanese philosophy that helps to find a purpose and a meaningful in all areas of life. And to find out your Ikigai, you need to reflect in the 4 pillars of life, which is passion, mission, professional, and vocation. So you have to choose what you want to do for the rest of your life, and to choose to do well, to treat patients as a whole, not only a bone. And as Khaled said, it's very important to be a really good doctor. And then you're going to be a very good orthopedic surgeon. So I think this helps to, at least to reflect in their time of life, to find your way, to be curious, to look for the places, learn as much as you can, study a lot, and then you are going to get all this knowledge to yourself. So you need to find your own way to be a better surgeon. And I think this is very important for the young people. So to be a good orthopedic surgeon, you need to do research, training, you need to teach, you have to have a global view of the world that we are in. You need to have leadership skills. You have to, as you get older, mentoring, collaboration, and all this will improve the quality of life of our patients. And I think this is a very nice concept for reflection. And again, I thank you very much for the invitation. I'm very proud to be a member of the fellowship committee of SICOT, because I'm a member for a long, long time. And thank you again.
Thank you so much, Professor Patricia. That talk was from the heart, mind, soul, and spirit. I'm really proud that you could put so much of thought and so much of introspection in an academic talk. I'm really impressed, and I'm touched as well. Thank you so much. The last talk before we go on to the discussion is my talk, essentially. And this talk is going to be on SICOT hybrid fellowships. And it's a new concept. The hybrid fellowships started last year, thanks to the pioneering effort of Professor Khaled here, who was always convinced that there has to be more than one way of educating people all over the world, educating orthopedic surgeons all over the world. And he convinced Dr. Vikas and Dr. Gao to put this as a part of the Pioneer program. And here we are. So what exactly is SICOT fellowships? Essentially, all my previous speakers have spoken about all the fellowships. That is the single center fellowship, the traveling fellowships, the SMS or the SICOT meets SICOT fellowship. And I'm going to be speaking only about the SICOT Pioneer Virtual Fellowship. So what is the SICOT Pioneer Virtual Fellowship? To understand that, you need to understand what SICOT Pioneer means. So SICOT Pioneer was a platform which was started by SICOT, a virtual teaching and training platform with a global approach towards orthopedic education to capture all ages and abolish the divide between country religion, continent, and have a disruptive, yes, progressive thinking and technology platform. So that is what Pioneer is. So essentially, the Pioneer platform is an online teaching training platform by SICOT. Now, the idea of having a Pioneer platform came during the COVID pandemic because all of us wanted to impart education, but we were not certain as to when we would be able to meet each other, visit different countries, and interact with each other. So one of our SICOTs was a hybrid SICOT, which was held at Budapest, where we had a combination of visitation as well as online conference. And that is where the Pioneer came from. Over a period of time, this has evolved into various different spokes, which includes the virtual education program, the virtual surgical training program, the fellowships about which I'm going to speak, the virtual SICOT exam, which you can give from a center in your own country, and also the SICOT virtual platform, which is in the process of development. So the Pioneer, essentially, to begin with, started with webinars, then talks on surgical techniques, podcasts, exam resources, education days online, practice resources, ortho evidence and journals, and a SICOT forum. Now, somewhere we found that there was definitely a scope, and Dr. Khalid was convinced that there is scope. And you know that when you have a good leader who can show you a path, who can show you a vision, or you trust his instincts and you follow that path. So we chose to follow the path of virtual fellowships, and here we are. So the SICOT Pioneer Virtual Fellowship essentially started off as two pilot projects. One, Limb Reconstruction and Deformity Correction Fellowship, which was led by Professor Khalid, and the second, Pediatric Orthopedic Fellowship, which I chose to take up as a challenge because we were not certain as to what the outcomes were going to be. But we were very upbeat about it, we were very confident about it, and we were very enthusiastic about it. And whenever you have enthusiasm, the plan will follow and you will be able to achieve what you wish to. So Professor Khalid chose to be the first mentor. He is an established member of SICOT, a great academician, a wonderful researcher with almost 30 years of experience. He essentially specializes in limb reconstruction and deformity correction. I specialize in children's orthopedics. I am based out of Mumbai, right now the chair of KB Bhava Municipal General Hospital. And I decided to run a pediatric orthopedic program. So what we did was we decided to structure these programs first so that the fellows to whom these programs were advertised had a fair idea of what they were getting into. So Dr. Khalid structured it wonderfully, where he had an introduction session. Then his first session was on principles of limb reconstruction and deformity correction. The second was on limb lengthening and limb length discrepancies. The third was on foot deformities. The fourth was on knee deformities. The fifth was on hip and pelvic deformities. And the sixth session was on long bone deformities, infections, and non-movements. So you can see that 6 sessions are about 1 to 2 hours each, but so comprehensive and, of course, case-based and practical-oriented, which I will come to later. And then we had the fellows, or the first batch of fellows, visiting Dr. Khalid in his center in Cairo about a month or two ago. The second was the program which I had started, which essentially started with an introduction. My first session was on upper limb trauma, pediatric trauma. The second session was on lower limb pediatric trauma. The third session was on skeletal deformities. The fourth session was on musculoskeletal infections in children. The fifth was on management of congenital anomalies with focus on CTV and VDH. And the sixth session was neuromuscular disorders like cerebral palsy. We're expecting our first batch of fellows to visit India somewhere around Jan-Feb 2025. Now, coming to the specifics of these fellowships, what did we exactly do? The phase 1, which I showed, was Dr. Khalid and me both conducted virtual teaching program modules of 6 weeks. And the second was the in-person visitation, which was about for a period of 1 week. So coming to the virtual teaching modules, what all did we do? We had comprehensive didactic teaching, including lectures on practical topics which are faced day in and day out by orthopedic surgeons. We had clinical teachings where we actually showed cases which are of interest to pediatric orthopedic surgeons. The third session was actually having cases where they could see the patient virtually, though it was not live, this was recorded, but they could actually see what the problem the patient had, and then we could have a discussion about it as regards the diagnosis and management. We also had short videos on sawbones where we conducted sawbone demonstrations online, again recorded. We had technique workshops wherein we showed various different casting techniques, various different types of club feet casts, hip spiker application, and those kind of videos. Like this child who's undergoing a club foot casting. We also had demonstration of deformity correction, again in the form of live videos, but we would stop the video at every stage and discuss it out with the fellows who were attending so that they could understand each and every step of these surgeries. We also showed them recorded teaching surgical videos and did a step-by-step discussion of what we were doing, what exactly was getting dissected, what exactly was getting lengthened, what exactly was being opened. All these things were discussed threadbare. The second part of this fellowship was the in-person visitation, which Dr. Khalid had at a center about a couple of months back. So these are the two fellows who came and visited Dr. Khalid at his center in Egypt. And as you can see, in addition to the academics, Dr. Khalid gave them a very generous dose of his hospitality, which even we have seen when we visited Egypt. So Dr. Khalid is not only a great mentor, but he's also a very, very great friend. So this is what you get when you visit a fellowship center. It is a cross of cultures where you get to understand so much more of dynamics in addition to what you do in your clinical practice. So coming to my last slide per se, why do I say that virtual fellowships is a mix of the best of both worlds? In a virtual fellowship, you can manage your own time because these lectures are once a week, maybe for 1 or 2 hours. So it can be manageable. It is monetarily feasible for people coming from countries where it may not be possible for you to travel or spend a lot of money in travel and stay. Because believe me, though SICOT funds your fellowship, but you do require additional funds. And if you don't have them, you can choose this modality. It is very convenient if you are an orthopedic surgeon who's reasonably busy, even if you're young. You can choose your convenience and choose this fellowship where you have to give only 1 week of visitation and 6 weeks of teaching and training. And it becomes a direct one-on-one channel. So you and your mentor are connected directly, and at any point in time, you can ask him questions, he can answer you. So it's not like a conference or a meeting where you get only one opportunity. You always are connected to your fellow, and you can speak to them and they can speak to you. They can come back with their questions, their cases, and you can help them out. The advantage of visitation is that you get to experience the subspecialty work, understand the culture of another region. You get major networking opportunities because this is how you build up your own network of orthopedic surgeons all across the world. And more than that, if you are somebody who's interested in long-term collaboration on research and those kind of partnerships, and if you find a mentor who's willing to support you in those fellowships, then it's a win-win situation. So in a short period of time, with convenience, monetary feasibility, a direct channel, that is a direct mentor, can offer you your time management, experience, understanding work culture, networking, and long-term collaboration. So I believe that hybrid fellowships may not be the future, but they are definitely a part of the future. And those watching this webinar today, or those who will watch it in the near future, should definitely consider this kind of a fellowship if you're looking for training opportunities and you are restricted on time, as well as you are challenged monetarily, or there are some other issues because of which you're not able to travel for a long duration of time. Thank you very much for the attention, and I shall stop my sharing. Thank you.
Thank you, Dr. Kini. Thank you very much. So now we have maybe 1 minute for questions. So if anyone have a question or a comment.
Sushant, anything from your side, if you want?
So, thank you, Swapnil sir, for this opportunity. I'm Dr. Sushant Srivastava. I'm an assistant professor working from Mahatma Gandhi Memorial Medical College, India. This question is open to the panel. First of all, thank you so much for your enriching and riveting talk. I asked this from a young trainee and also a person who is actively involved in teaching as well. Do you consider or give weightage to any of the inland fellowships which we have? I mean, a native country fellowship, while while actually considering the applications for a SICOT fellowship. So, if a candidate has done a fellowship in his own native country and a fellowship in the specialty in which he wants to pursue the fellowship in SICOT, so is there some weightage given to that?
I'm not sure if you have understood this. What he means is that if you've already done one fellowship in your own country, a local fellowship, do you have any further weightage to get a SICOT fellowship? So maybe Professor Khalid and then Professor Basil can answer that question.
Yeah, I think you have a chance. Yeah, because we every fellowship, we didn't put any kind of score regarding if you had a previous fellowship or not. So scoring system that we have does not include that if you had a fellowship at your country or not. So yeah, you have a chance, as Dr. Bassett explained in his presentation. Yeah.
Thank you, sir.
Yeah, I basically I totally agree with Khalid. Anything you are not eligible to have back fellowship, SICOT fellowship. Okay, so it's back-to-back SICOT fellowship. Other than that, you are more than welcome.
Thank you, sir.
Right. So I think Patricia, did you have to add something to that?
No, I was very pleased to see the outcomes of the virtual fellowship. Amazing. Congratulations. Beautiful, beautiful work.
We expect in the near future, after we have the assessment with the committee and with this pilot program, we will send to the other subspecialty committees. So every subspecialty committee will start working on creating a curriculum and a virtual fellowship program within 2025, hopefully. Yeah. So,
yeah. Congratulations to both of you.
Oh, you're welcome. It's a great thing.
So,
okay.
I think, Sushant, that's about it. So on behalf of the Bombay Orthopedic Society, I thank all the faculty present here today. I think Dr. Toulouse is left probably, but thank you so much for giving your time.
Thank you. So the recording would be available on the YouTube, right?
Yes, we will give you the link also. It can be shared. And if people have not been able to see it, they can share it for certain.
We'll see you in Madrid.
Thank you. Take care.
Thank you. Thank you.
Yeah.